Hi everyone, I am Jayashree from Vasavi Vidyalaya. We are now passing through the most critical situation as this coronavirus gets spread so rapidly. We all know that on March 11, 2020, the World Health Organization officially changed the designation of COVID-19, an illness caused by a coronavirus, from an epidemic to a pandemic. An epidemic is defined as an outbreak of a disease that spreads quickly and affects a wide range of population at the same time, whereas a pandemic is defined as an outbreak of a disease that covers a very wide geographic area and affects an exclusively higher proportion of the human population. Now it has affected nearly 213 countries and taken away the lives of nearly 6 lakh people. At this point, our students will give you a presentation on what is COVID-19, the ways of its transmission, the statistical data which shows how much it has been affected throughout the world as well as in our own country, the precautionary measures taken, and the simplest and the most effective home remedies that will enhance the immunity power as well as resistance power. So let's get tuned to it. Thank you.
Warm greetings to all of you. I'm here to present you about the coronavirus, COVID-19, the great pandemic that made the world upended. Each and every citizen of this world is now cautious about this tiny little virus. But what actually is this tiny little virus? Why is it so difficult for humans to find a cure to this illness? Can we overcome this pandemic? Is this the greatest of diseases that has occurred in human history? What home remedies can we adopt to overcome this pandemic? Well, all these questions are yet to be covered in this presentation, so stay tuned. So, after all this discussion, there is one more thing that speaks about the coronavirus, the origin of the coronavirus. Coronaviruses were first discovered in the 1960s in animals. In the 1940s, 2 more coronaviruses were discovered. Thankfully, they were isolated. But the scientists at that time did not know that these 3 coronaviruses were related. Human coronaviruses were first discovered in the 1960s, but thankfully they were isolated. But still then, many coronaviruses has been identified since the 1960s. Now it has thrived again in its perfect form. Even though the coronavirus started in the Wuhan city of China, it began to broaden its strength all around the world. Quite surprisingly, the first person to be a victim of the coronavirus in India was at Thrissur. Statistically, within 3 months of the coronavirus, over 1 crore people all over the world has been affected with this virus. So, in order to tackle this great pandemic, it is the responsibility of each and every citizen of the world to take certain measures to overcome this pandemic and to prevent its spreadness. So, without further ado, let's look at the symptoms of the coronavirus.
Hello everyone, I'm Ardra Revkumar and I've made a presentation on the symptoms of coronavirus. So as you can see in the first slide, I've described coronavirus as the worldwide destructor as it is decimating our Earth's population. And in the first picture, we can see that COVID-19 is actually the short form of coronavirus disease 2019. 2019 is for the year in which coronavirus originated in Wuhan in China. And we can also see the basic structure of coronavirus in both the pictures. We can see our Honorable Prime Minister Shri Narendra Modi holding a card in which he has coined an acronym for Corona in Hindi. Co stands for Koi, Ro stands for Road Per, and Na stands for Na Nikle. It is actually a sentence. Koi road per na nikle, which means no one should go out onto the roads and get infected. They should stay home. This was done to spread awareness among the people. As the triple nationwide lockdown was put in place on March 24th, 2020. And in the first picture, we can see a wall painting of the same acronym in Raipur. On to the symptoms. Different people have a variety of immunity levels, and thus coronavirus affects different people in different ways. And most people might recover without hospitalization as they catch only mild to moderate symptoms. Symptoms can be mainly of three types: most common symptoms, less common symptoms, and serious symptoms. Most common symptoms include fever, dry cough, tiredness, chills, and muscle pain. In this table, we can see that some symptoms are listed, and along with it, it is said whether it occurs commonly, occurs sometimes, or it occurs rarely. And the only two main common symptoms include fever and dry cough. And those symptoms which are listed along with sometimes are actually less common symptoms, such as fatigue, which means tiredness, aches and pains in different parts of the body, then sore throat, which causes throat pain, headaches, and shortness of breath. Then other less common symptoms include diarrhea and conjunctivitis, loss of taste or smell, discoloration of fingers and toes, which means that fingers and toes may look pale, and bluish color of the lips. Serious symptoms are those symptoms which show us that the person has to be admitted in the hospital and has to be kept in the ventilator. Serious symptoms include three main symptoms, which the first one is difficulty in breathing or shortness of breath, which shows us that the person needs external supply of oxygen. Second one is chest pain or pressure due to the activity of the coronavirus in our lungs. And the third one is loss of speech or movement. This is actually a very rare symptom. And in the picture, we can see the different parts of the body coronavirus affects. And it is also written that it spreads via coughing and sneezing due to the droplets which come from our nose and mouth. People with mild symptoms who are otherwise healthy and do not catch other diseases, who are immune to other diseases, and who can just mild symptoms like a light fever or headache, can manage their symptoms at home and can also recover without hospitalization. And suppose if we catch the coronavirus, it will take a minimum of 5 to 6 days for the symptoms to show, for us to recognize that we have got the virus, we have been infected. However, it can take up to a maximum of 14 days. And in this slide, we can see a picture of the hospital corridor of a coronavirus treatment ward. Slide, we can see the results of a survey conducted by scientists and experts in China based on 55,000 corona cases. And they have found out that COVID-19 causes symptoms similar to that of the flu. And the most common symptoms, as I told earlier, fever and dry cough. Fever occurs in 88% of the cases, and dry cough occurs in 68% of the cases, which shows us that these are the most common symptoms. And then the less common symptoms include fatigue, which occurs in 38% of the cases, producing phlegm 33%, shortness of breath is just 19%, and sore throat and headache each 14%, which shows us that these are very rare symptoms. Now, this is a picture of the world burning away. I think that it might be due to the harmful human activities like industrialization, urbanization, releasing smoke and other pollutants into land, water and air, which in turn causes global warming, ozone layer depletion, pollution and many other harmful effects on Earth. And this might also cause the extinction of a variety of species of plants and animals from the Earth. And in the long run, in the end, it might even cause the extinction of human species themselves. Now, during these tough and difficult times, all I've got to say is to quote two people actually. One is John Lennon. He is a singer and songwriter and also a peace activist. He has said that what we have got to do is keep hope alive, because without it we will sing. Next is Kofi Annan, the 7th Secretary General of the United Nations and 2001 Nobel Peace Prize recipient. He has said, we need to keep hope alive and strive to do better. We need to have strong hope on the people and on our country and on the whole world that we will fight and live through this pandemic. And only if we strive to do better, if we try to do better than the previous days, can we improve our condition and make the world a better place to live? Here I've got some pictures. The first picture actually shows the earth wearing a mask and people are actually trying to convey the message of stay home. The second picture shows a nurse protecting India in her arms from the coronavirus and it says, Aap surakshit to desh surakshit. If we are safe, the whole of India is safe. Whole country is safe. And this painting was done to honor the doctors, nurses, cleaning workers and the policemen and policewomen who work during these hard and difficult times. There's another picture of a person sanitizing the area and in the background there's a wall painting of the doctor wearing the whole PPE kit, a lady policewoman wearing a mask and a lady nurse. And then there's a picture of people wearing masks and standing in a queue maintaining social distance. And this is going to be the new normal. Thank you.
Hello, I'm Ashley John. I'm here to talk about the human-nature relationship before and during the pandemic COVID-19. The humans impact the environment in many ways: overpopulation, pollution, burning fossil fuels, and deforestation. And these activities triggers climate change, soil erosion, undrinkable water, and poor air quality. Humans exert a great pressure on the natural world. Habitats and species suffer not only from the environmental changes caused by industry and technology, but also from the strain caused by the world's massive human population, which has been doubled in the past 50 years and is rising rapidly. While we are panicking about COVID-19, our Mother Earth is healing. The pandemic literally shut down the whole world. It helped nature reclaim its features and heal the damages caused by the humans. The water in the canals of Venice is running clear. We can say that the visibility and atmosphere in these areas have been improved a lot. The polluted skies have turned blue. The chirping of birds can be heard again. This can be said as the silver lining to the coronavirus lockdowns. The pandemic has caused industrial activities to shut down and cancel flights and other journeys, slashing greenhouse gas emissions and air pollution around the world. Plane and car emissions have fallen, which led to the reduction of impurities in the air. Though the air quality is improved, there is clear water in Venice canals, blue skies over Delhi, and the wild animals are roaming outside their zones. There is 25% reduction in the carbon emissions and 50% reduction in the nitrogen emissions. The number of accidents have fallen in lockdown as there are less vehicles on the roads. Whatever the advantages may be, there is always a dark side to everything. The lockdowns have given cover for some illegal activities such as deforestation of the Amazon rainforest and poaching in Africa. These will be seen on the news as a pregnant elephant died due to the severe injury caused by the crackers which were hidden in a pineapple. This was not intentional, but it became an end to two good lives. Just because the lockdowns brought some climate change doesn't mean it's eternal, and the list of advantages and disadvantages of the pandemic season does not end here. Instead of that list, we should focus on the most important thing right now, our health. Thank you to all the superheroes in PPE kits, khaki uniforms, and the ones who led us through this pandemic.
Hello everyone. Today we'll be talking about one of the world's most destructive pandemic, COVID-19. COVID-19 is caused due to SARS-CoV virus, which belongs to the family Coronaviridae, the same family to which SARS and MERS belong. Looking at the COVID statistics, we get to know that COVID-19 was first reported in Wuhan in China. Within a few days, it spread across the globe. Today, there are over 11 million cases worldwide. Although this infection has proved to be highly contagious, the death rate of this is still lower than that of SARS and MERS. Of all the countries this tiny virus has enslaved, the United States of America has been the worst hit with over 3 million cases. India is not far behind. It occupies the third position, preceded by Brazil. Amidst this desperate situation, there are a few countries which have overcome this infection with both protection and care. 9 countries, including New Zealand and Fiji, have reported 0 active COVID cases. Germany has the highest recovery rate of more than 92%. India has recorded of more than 7 lakh COVID cases. Looking at the states of India, Maharashtra leads the list, followed by Tamil Nadu, Delhi, Gujarat, West Bengal and Uttar Pradesh. In Maharashtra, of the total 2 lakh cases reported, 9,000 have proved to be fatal. Looking at the stats, we get to know that Kerala, with over 5,000 cases, occupies the 20th position. If we look at the infection rate and the death rate, we get to know that India occupies the 3rd position in infection rate and the 7th position in the death rate. India's death rate is about 2.7%, which is far lower than the average global fatality rate of about 4.8%. If we closely observe the COVID patients across the world, one thing is quite clear. Although COVID-19 infects both males and females equally, the disease proves to be more fatal in males. The death rate in males is 2.8 times greater than that in females. There can be many reasons for this, but a study shows that there are mainly 2 reasons. First, smoking. Smokers tend to have a lower lung capacity and are more prone to this disease. Moreover, there is a higher risk of virus transmission from their hands to the lips. Second, X chromosome proves to be vital for the proper functioning of our immune system. While males have 1 X chromosome, females have 2. Looking at the stats across age groups, the recovery rate is the highest of the age group from 0 to 17 years, while both the infection and the death rate is highest at the 65 plus age groups. One of the reasons for this is because of the weaker immune system and the presence of other lifestyle disorders such as diabetes present in the older adults.
Hi everyone, myself I am Nandana Vinod. Now I am here to talk about the ways of transmission of the COVID-19 or the coronavirus. So you can see there on the right left hand corner you can see a small picture of corona. So much beautiful from outside, as you all know, but it's not that beautiful from inside. Now coming to the second slide, we can see the modes of transmission of the coronavirus. There are mainly 3 modes of transmission. The first one is the droplet transmission, second one is the airborne transmission, and third one is the surface transmission. First we'll go into the droplet transmission, as it's a very common way of transmission, and we can say that the COVID-19 spreads from an infected person from small droplets from their nose or mouth. When the person coughs, sneezes or exhales, they are spread into the air. And therefore, any other person, any uninfected person can get the COVID-19 virus from the small droplets. Now coming to the second slide. The WHO defines that the respiratory infections are transmitted through respiratory droplets of different sizes. As we can see in the droplet transmission, there are so much sizes of respiratory droplets. The droplets which are more than 5 to 10 micrometer, they are referred to as respiratory droplets. And the droplets which are less than 5 micrometer are referred to as droplet nuclei. So according to the current evidence, COVID-19 primarily transmits through respiratory droplets and contact foods. In the next slide, we can see an image which says that COVID-19 primarily spreads from person to person. And that is the droplets coming from someone's neck who sneezes, coughs, and these droplets may land on some persons nearby, and therefore they can get coronavirus. So that is the main reason why social distancing is so much important to prevent the droplet transmission or the person-to-person transmission. Now coming to the next slide, we can see image which shows the importance of social distancing. That is, we should stay at least 6 feet apart with anyone who is sick or not sick. So it is a best way to prevent the droplet transmission. And we can see that I have made a small acronym, that is MST, which means maintain social distancing. And you may feel that it may be MS Dhoni, but it's not like that. MST means maintain social distancing. This is the acronym made by the Mumbai police just yesterday, that is 7/7/2020, because it was Dhoni's birthday. Now, so we can use this acronym to maintain social distancing. Then, now coming to the next slide, we can know about the airborne transmission. But coming to airborne transmission, the first picture shows that there are two types of droplets, respiratory droplets and some more smaller droplets that we call the aerosols. In the picture, a person sick coughs or sneezes, and these bigger droplets are spread into the air and the space in which the person is standing. And therefore, the small aerosols travel long distances in time, and they can travel more than 1 meter. So that is why we are keeping a safe distance that is of 2 meter, more than 2 meter, that is a 6 feet. So now we are going to look about the airborne transmission. The WHO defines airborne transmission as a spread of an infectious agent caused due to the dissemination of a droplet nuclei which remain infectious when suspended in air over long distances and time. So this airborne transmission is somewhat different from droplet transmission. It refers to the presence of microbes in the droplet nuclei which are of diameter less than 5 micrometer. Now we are looking into the next slide, which shows the two pictures of the importance of wearing mask. Now the next topic is the surface transmission. A person with COVID-19, when coughs, sneezes, the small droplets may come out of the nose and mouth of the person, and therefore these droplets may land on the surfaces and objects near them. So if any uninfected person touches these surfaces and then touch their nose, mouth, or their conjunctiva or their eyes, they may have a high risk of getting the COVID-19. So in order to prevent the surface transmission, we are using soap and sanitizer. So while looking into the duration of the contamination of the surfaces and objects, we look into the plastic first. Plastic, the coronavirus can stay up to 2 to 3 days, and stainless steel too, it can stay up to 2 to 3 days. By looking into the cardboard, it stays up to 1 day, and the copper, it stays up to 4 hours. This may vary under certain conditions and the temperature and humidity of the environment. Now we are going to look at the ways to prevent the surface transmission. By looking into the ways to prevent the surface transmission, there are around 2 ways. By using the soap or sanitizer, we can kill the germs that gets landed on our objects or hands. And now looking into the next slide, you can see the SMS. It's a small acronym. That first S stands for soap or sanitizer, and M stands for mask, and another S stands for social distancing. So just insist all of you please follow these three letters, that is the SMS, and thank you.
Preventive measures of coronavirus. So now let's see some measures to prevent corona, and they are staying at home, wearing a mask in public, avoid traveling, social distancing, washing our hands with soap and water often and for 20 seconds, practicing good respiratory hygiene. Avoiding touching the eyes, nose or mouth with unwashed hands are some of the preventive measures that we can follow in our day-to-day life during this COVID-19 pandemic. Steps to protect yourself. Avoid close contact, clean your hands often, stay at home, cover coughs and sneezes, wear a face mask if you're sick, clean and disinfect. Other measures. Improve your diet by including food items having vitamin C, vitamin D, zinc, etc. Don't compromise in your sleep. Always try to stay hydrated. Don't skip your exercise routines. Avoid smoking, alcohol and other addictive substances. Use proper mask like N95 mask, surgical mask, 3-layer mask or handkerchiefs while going out in public. Help stop the spread of corona. So now you can see here a picture showing some measures to prevent coronavirus, like avoid close contact, cover coughs and sneezes, avoid touching the eyes, nose or mouth, stay at home, clean your hands often, practice other good health habits, etc. can be seen in this picture. So now you can see here another picture showing 8 do's and don'ts during COVID-19 pandemic. Some of these measures are already mentioned earlier. So I hope you all will try to follow all these measures to protect yourself and the people around you, that is your near and dear people. So all of you please try to follow all these measures during this adverse time. So next is some natural remedies to boost our immunity. So now here you can see some pictures of some ingredients which are very rich in vitamins and which are very useful to our health in many different ways, and mainly in boosting our immunity. So I would like to tell you all that you all must add all these ingredients in your daily diet to boost your immunity. As you all know, coronavirus or COVID-19 is severely affected for those whose immune system is very weak. So let's all have all these ingredients and boost our immune system. Drink warm water throughout the day. Practice meditation, yoga, etc. Try to do exercise up to 30 to 40 minutes depending upon your stamina. Increase the intake of turmeric, coriander, and garlic. Drink herbal tea, cinnamon, black pepper, raisin, etc. Avoid sugar and replace it with jaggery if needed. Inhale steam with mint leaves and caraway seeds. By the reports, a COVID 19 or coronavirus vaccine is not expected until 2021 at the earliest. So, at present, there are no vaccines or antiviral drugs to prevent or treat human coronavirus. So, the only medicine is to protect ourselves by following the instructions and measures provided by the World Health Organization (WHO) and our government authorities. So, let's all fight together against this coronavirus by following all the preventive measures and remedies for protecting ourselves so that we can build a better future.
Hi, welcome. Myself Aditya. Even though there is no treatment protocol or vaccination founded yet to treat COVID 19, there are enough ways and measures we can take in order to prevent the transmission of COVID 19. Now, let's discuss about some more sufficient ways in order to prevent the COVID spread. Ways which we are using to prevent COVID 19 is sanitizing our hands, wearing masks at public places, and maintaining social distancing at every public places and public gathering. Now, let's discuss about some more sufficient ways in order to prevent the COVID spread. Wash your hands frequently and carefully. Always use hot or warm water with soap or alcohol content sanitizer in order to wash your hands frequently. At least wash your hands for a minimum of 20 seconds. Wash your hands several times, including whenever you are touching your laptop, mobile phone, etc. Avoid touching your faces frequently. The SARS-CoV-19 virus can live up to 72 hours. That's only the face. Even our eyes, mouth and nose can get transmitted. It's important thing. Stop biting your nails. Because through your nails also the COVID can get transmitted to you. The picture you see says let's fight safely COVID-19. Because in order to fight safely, it only needs sufficient precautionary measure. Number 3. Don't share personal items. Even your mobile, laptop, makeup kits and even your comb. If an infected person has COVID-19, from his hands, it gets transmitted to whatever things or whatever surface he touches. So there are high chances that through that surface, when you are touching, the virus can get transmitted to you. So don't share your personal item. Teach your children to use reusable utilizers, reusable cup, reusable straws, and teach them a habit of using their own things. For children are a very sufficient way in order to prevent the transmission of COVID-19. Point number 4. Always cover your mouth and nose whenever you are coughing or sneezing. That the COVID-19 virus are mostly found in your nose and mouth, and while sneezing or coughing, it may get transferred from your mouth to the air and it may lead to the air droplet transmission. The thing is, the virus can only land on hard surface and live up to 3 days. That is enough for getting transmitted. Thus, it is highly recommended to cover your mouth and nose while sneezing or coughing. Nature you see says a lot, indeed a lot. The harm we have done to the nature and our Mother Earth isn't small enough. So, this corona time is a wake-up call to us to build a new, loving society that is eco-friendly, physical or social distancing seriously. The thing is, we all know social distancing, but we take it in a silly manner. Physical distancing or social distancing is a highly efficient method in order to prevent the transmission of COVID-19. Social distancing also means staying home and working remotely if possible. Whenever you are in a public gathering, try to keep a distance of minimum 2 meters from every person and you. Quarantine. Tip number 6. You have heard quarantine a lot, but it's highly recommended to stay home or away from other. Go for a self-quarantine if you're sick or if you feel uncomfortable. Also take a precautionary measures. Go quarantine yourself and call your doctor and inform them. People get tensed and scared about COVID-19 and many hide their symptoms. The one thing that we have learned in this period is don't hide the COVID-19 symptoms. Call the medical care and inform them. Get your medical attention done. They are with us. Together, we can beat this coronavirus. We have faced many other things. World wars, Nipah, everything. Coronavirus is just one among them. Let's do this together. Opportunity. All of us from Vasavi like to salute our real-time heroes. They are the ones having their sleeps off and working for us. We really admire you. Thank you. Stay home, stay safe, and together we can beat this COVID-19 too.
The coronavirus is spreading like a wildfire to all different parts of the world, but not everyone knows what is coronavirus. So we, the students of class 11, Vasavi Vidyalaya, have taken this initiative to help inform people through social media. So I would like to take this opportunity to thank all those people without whom this would not have been possible. First of all, I would like to thank Mrs. Preeti B, our principal, who gave us this wonderful opportunity to help spread awareness on the coronavirus. Then I would like to thank Mrs. Jayashree ma'am, our English teacher, who supported us and helped us in organizing this, and Dilip sir, who helped us with the video. Thank you.